Okay, so welcome everyone to this 3IE DEval webinar. My name is Brück. I'm a senior manager for synthesis and reviews at 3IE, and I'll be chairing this session. It's a great pleasure to host this webinar today, where we're going to launch the results of an evidence gap map on building peaceful societies in fragile contexts. This work represents a co-production with the German Institute for Development Evaluation. And I think personally for me and from the whole team, this has been a great experience and a great collaboration with our German colleagues, also including stakeholders from both BMZ, who's also supported the work financially, and GIZ and the NGO sectors, where we've had also repeated consultations, etc. So we have a nice lineup of speakers for today. So I'm shortly going to hand over to Marian Kramer, who is the team leader for impact evaluation work at DEval, and she will give a few introductory remarks. I will then pass on to Ada Sonnenfeld, who is the lead author of this evidence gap map, and she's also an evaluation specialist at 3IE. Then I will pass on to Ada will speak for around 20 minutes. And then we have two great discussants who will both speak for between 5 and 10 minutes each. So we have Henriette Sachse, who is a senior policy advisor at the Division for Transitional Assistance at BMZ. And then we have Professor Tilman Brück, who is the founder and director of the International Security and Development Center, and also a visiting professor at the LSE. And so then the idea is that after we've had the presentation and we've had the contributions from our discussants, we have between half an hour and 40 minutes for questions and answers from all of you guys joining us today. Before we start, a couple of housekeeping messages. So this webinar will be recorded, and we will disseminate the recording afterwards. It's also being streamed live on YouTube to help those who are not able to use Zoom also follow the event. For the audience, there are a couple of functions that you can use to communicate with us. So there is the chat function, where I can see several of you have already started writing messages. So this is for messages kind of more of a technical nature. If you have problems with the audio, etc., if you just want to make comments. And then there is the Q&A function, which is where you can post the questions that you would like the panel to address towards the end. And finally, just to say, that there have been some cases of Zoom webinars being hacked or taken over by trolls, should that happen, we will just close this down and reschedule the event. But fingers crossed, we will avoid that. And so with that, I'd like to hand over to Marian. Thank you.
Yeah, thank you very much, Berthe. I just wanted to say a warm welcome from DEval's side as well. So I'm very excited about this event today, and that we finished the evidence gap map and the report, and the fact that I'm seeing about 230 35 participants kind of reflects that maybe more people are excited about this evidence gap map. So for me, it's mostly two reasons that I think that this evidence gap map it's really interesting. One is that I think given the current situation of the pandemic, the topic is more relevant than ever. So for a couple of reasons, inequality might go up dramatically in the future, and given the circumstances, knowing what we know about interventions to secure and build peaceful societies will be very important in the future. And the second reason I'm excited about is to see how this evidence gap map will be used for policymaking and programming. So to my knowledge, this is, at least in Germany, one of the first evidence gap maps that have ever been produced or produced with the German Development Corporation. So I'm really excited to see what we can learn from it, how it will be adopted. I'm very much looking forward what Henriette Sachse will say later on regarding how the unit of transitional development assistance from BMZ will use this evidence gap map, and also to hear about the thoughts and ideas for adaptation from the audience in general. From my side, also a big thank to 3IE for this amazing work, for the good collaboration, and as well to BMZ for providing funding, and particularly to the unit of transitional aid who were really interested in going on this evidence journey, and also the unit that is mostly driving the evidence journey, at least in German Development Corporation. That's it from my side, and I'm very much looking forward to Ada's presentation.
All right, thank you very much, Berta and Marion, for lovely introductions. And thank you very much to Professor Brück and Ms. Sachse for joining us. We're really happy to have your participation. I'm very much looking forward to hearing your thoughts. And also to all of our audience members, I'm really looking forward to hearing what you think about this work. So just to get started. So 3IE, just as a quick introduction to who we are primarily a grant maker and of impact evaluations and rigorous evidence in lower and middle income countries. We're a convener of forums to build a culture of evaluation and of evidence. And we are a producer of knowledge for policymakers, program managers, researchers, civil society, and donors. And we're a champion of global public evidence goods. And what we mean by that is that all of our work is freely available to everybody, because we believe that knowledge is something that should be shared and that we should all be able to access and learn from. So an evidence gap map, I think the first thing to go through is what is an EGM and why do we use them? So an evidence gap map helps us identify what we know and what we don't know about the effectiveness of interventions in a given sector or subsector. In this situation, we've looked specifically at a broad range of interventions that aim to build peaceful societies. And what we do in the map is we plot the evidence base for impact evaluations and systematic reviews. You know, from a specifically about this evidence gap map, we recognize that protracted conflicts are now the norm, and there's documented evidence of the very expensive and long-term consequences of protracted conflicts and fragility. And that has made building peace and building sustainable peace all the more important. Further, a very large proportion of official development assistance is spent in fragile contexts, over 50% based off of data from the OECD DAC and the Fragile States Index. That amounts to over $50 billion US, which is a huge investment. And so it's really important to know how effective that money is on reaching on building sustainable peace and achieving the outcomes that we're aiming for. And so evidence gap maps then can help us improve the effectiveness of this official development assistance and of programming because they identify where the evidence is and give easy access when in the program design phase, as well as during implementation, to identify potentially relevant evidence from other similar contexts or similar interventions that might help inform better programming. So an evidence gap map on 3IE looks something like this. You have a list of key outcomes across the top, which will be grouped and then have specific outcomes below. Then you have intervention categories down the side. You have gray circles denote impact evaluations. With the larger the bubble, the greater the number of studies. And colored circles show systematic reviews. We show systematic reviews at 3 confidence levels: low confidence, medium, and high. And what we mean by that is the extent to which we can be confident in the fact that the review has taken sufficient methodological quality to ensure that the results that it presents are based off of all of the evidence that is available and aren't free from bias in how they have interpreted that evidence. And then empty boxes show gaps in the evidence base where we were not able to find any impact evaluations or systematic reviews. Finally, there are boxes that have an NA for not applicable. And this is for intersections between an intervention and an outcome where we would not expect to see an effect. For example, a demining program is unlikely to change civic participation outcomes. And so we don't want to overstate gaps in the evidence base where theory suggests that a relationship would not exist. At the top of the map, you can filter the evidence base by a number of key factors, including region, country, study design, different population groups such as displaced populations, youth, women, and a few others. And also the scope of target at this map. And what we mean by scope of target here is you can look for interventions that were implemented at a local level with communities, at a subnational level, and at a national level. So we tried to make it as easy as possible for you to identify the evidence that is most relevant to your work. You have the link to the interactive map at the bottom here, but I believe it's also been pasted into the chat if you would like to click through to it and play around with the studies and see what you can find. If you click on a bubble, you will get a list of all of the studies that are contained in that bubble, and from there you can click through to the studies themselves. So in this Building Peaceful Societies evidence gap map, we wanted to introduce or to map the entire evidence base of interventions that aim to build peaceful societies. And the reason we've called this the Building Peaceful Societies evidence gap map and not peace building is that we took a very broad approach to peace building. And we recognize that in the literature, there's a quote unquote, so to speak, small tent peace building that focuses on the direct drivers and actors within a conflict. And we've got 3 different groups of interventions in this small tent. Those focus on strengthening social well-being, empathy and conflict resolution, supporting peace processes, oversight and post-conflict justice, and ending violence and building a safe and secure environment. However, we also believe that there's a large amount of theory and increasing evidence that suggests that interventions that target the underlying drivers of tensions may be equally critical to building sustainable peace. And for that reason, we've included all of these groups under a big tent of peace building. And so that additionally includes interventions that aim to build a strong and inclusive civil society, to build sustainable economic foundations and livelihoods, and build inclusive and accountable state institutions at all levels. Across the outcomes, we've grouped our outcomes into governance, social cohesion and trust, violence reduction, and finally human security and resilience. So what did we find? Well, we found that the evidence base is growing. The number of impact evaluations over time has been consistently growing, especially since 2012. There's been a number of uptick in the number of impact evaluations published per year. And we think that's really exciting. So as such, there's a lot of evidence that you can access through this map. And we encourage people that when you're designing new policies and programs to look at the map and see what evidence exists that either might be from a similar geography or a similar type of intervention, or trying to impact a similar outcome that that you're interested in. We also found a number of ongoing studies, 47 impact evaluations and 5 systematic reviews that are ongoing. And what's interesting here is there's been a slight shift from what the existing evidence base looks like to what the ongoing evidence base looks like. There's a large number and increasing evidence for economic foundations and livelihoods interventions in fragile contexts. To the extent that we actually found more ongoing impact evaluations in that section than completed ones for many interventions. However, despite the fact that the evidence base is growing, it's also quite fractured and unevenly distributed. I recognize it might be a bit difficult to read the specific intervention names listed down the left, but what I want to highlight is how you can see there's one very clear outlier, and that's mental health and psychosocial support. We found almost a third of the included studies were of mental health and psychosocial support. But across all, we found 195 impact evaluations, 47 ongoing impact evaluations, 29 systematic reviews, and 5 ongoing reviews. You can see, yeah, the mental health is by far the greatest outlier. And so in our analysis, we've separated that out so that you can differentiate between what's a mental health finding and what's a finding for all of the other types of impact evaluations. We also found very few impact evaluations of complex programs. And in order to do this analysis, we looked at each included study and tried to see what strategies it used in order to build sustainable peace. And we based this off of a matrix of peacebuilding approaches developed in the Reflecting on Peace Practice project that was articulated in Anderson 2004, which posited that in order to build sustainable peace, you needed to promote change both at an individual level and at a socio-political level, and that those two approaches needed to be linked up in order to be effective. And that further than that, you needed to have joined up strategies that both aim to engage a broader range of people in peace processes, while also specifically targeting a few key individuals who might be particularly critical to this. And what we found when we looked at the included impact evaluations was that 75% of the studies that were evaluated only applied an approach that fell into one quadrant. And most of these were interventions that aimed to affect change at an individual level, so dealing with personal beliefs and attitudes and knowledge, and tried to engage more people. We also found that certain key outcomes are assessed infrequently. I think one of the things that surprised us a lot about what we found was that there were very few evaluations that measured the effects of natural resource management outcomes, even though control over and access to natural resources is often cited in the literature as a driver of conflict. We did not find many studies that analyzed both natural resource outcomes and outcomes of governance and social cohesion and violence. There are also key geographic gaps in the evidence base. So this is a map that takes the heat map developed by the Fragile States Index, or in the Fragile States Index developed by the Fund for Peace, and overlays it with the number of impact evaluations by country that we identified. And what you can see is that there's 0 impact evaluations identified for 11 countries that have high levels of fragility. And this shows that there's a key gap in some of the most fragile areas. But what's interesting is that this gap does not align directly with fragility. For example, 2 countries that have quite high levels of fragility, Afghanistan and the Democratic Republic of Congo, had pretty healthy evidence bases with over 14 and 15 impact evaluations each. And this is important because in these fragile contexts, these countries where there are high levels of fragility and no impact evaluation evidence, over $17 billion was invested in official development assistance in those countries in 2017. And that shows that there's a lot of ongoing programming. We just don't have rigorous evidence coming from that programming. And yet the situations in Afghanistan and DRC show that it is possible. There are many examples of rigorous studies that have been undertaken in these challenging contexts. We also looked at the study methods and the extent to which different impact evaluations and systematic reviews addressed concerns of equity and ethics. So about 3/4 of our sample were experimental studies within the impact evaluations, and 1/4 were quasi-experimental designs. Around 1/3 of the overall sample used mixed methods, and that's quite low. Mixed methods are often considered one of the ways in which a study can better deal with complexity, and fragile contexts are often recognized as being inherently quite complex. There are a lot of underlying drivers of fragility and tensions. Interventions often are only able to influence a small area, and there are lots of other factors that are beyond their control that are affecting how people respond to the intervention. And mixed methods are one of the best ways that we have within research to understand that process and what's going on there. Another is theory of change. Similarly, about 1/3 of the studies included a theory of change. But what's promising there is that it looks like the use of theory of change is increasing over time. You can see the graph that the percentage by year of impact evaluations published that used theories of change within the study has been growing. So that's quite encouraging. It's also concerning, however, that only about 1/3 of the included impact evaluations reported receiving ethics approval from a review board. Now, we don't know if that's a lack of reporting, the fact that they had received ethics approval and just didn't note it in the impact evaluation, or whether they had not sought ethics approval and as a result didn't report it. It's a challenging context because a lot of these impact evaluations are undertaken by NGOs who may not have access to the university internal review boards that academics do. And so this is one of the things that 3IE as an institution is thinking about, how we can maybe support this, because we feel that it's really important for everybody to undertake ethics, consider a very thorough approach to ethics and equity prior to undertaking this type of research, especially in fragile contexts where the risk and potential for doing harm and accidentally exacerbating tensions can be considered a bit higher. And finally, the last thing to note on this side is that fewer than 20% of the included studies disaggregated results by gender or other subgroup analysis. And that's quite concerning because that means there's a risk that the potentially different experiences of different groups within an intervention might not be captured. And I think in fragile contexts, you often have different people who are affected very differently by the conflict context, and you want to make sure that an intervention is not only working for one subset of the population that you're targeting. On a more positive note, we did identify 5 clusters, emerging clusters of evidence, where there are a number of impact evaluations and not yet at many systematic reviews or out-of-date systematic reviews. So 2 of these, the first 2, we've actually, in partnership with GIZ, decided to start working on based off of the findings of this evidence gap map. The first one is a systematic review that looks at the impact of interventions aiming to build social cohesion in fragile contexts, while the second is one that looks at women as agents of change in building peace. A third opportunity for synthesis is around interventions promoting accountable and inclusive state institutions in fragile contexts. We found quite a number of impact evaluations that covered interventions in the fields of governance and accountability, in specifically looking at fragile states. And this is a new opportunity that we hope somebody will take up. And then we found 2 emerging clusters where there, like I mentioned at the beginning of this presentation, where there's a lot of ongoing work being done to evaluate the effects of these types of interventions. And so we don't think it's the right time to synthesize this evidence yet, because within the next few years, we expect to see so many new impact evaluations published. And that's the first one of those is for life skills and employment training in fragile situations. And the second is cash transfers and subsidies to support people living in fragile situations. Another thing that we did with this review was we looked at all of the systematic reviews that we found. As I mentioned at the beginning, we undertook a critical appraisal of every systematic review included in the EGM and classified it according to its methodological quality in terms of the extent to which we could have high, medium, or low confidence in its findings. Then we took all of the reviews with medium or high confidence findings, and we looked at we extracted the data from them in the findings and did a kind of rough synthesis of what they found. And so more details of that are in the report, but I just wanted to share with you an example from some of the mental health reviews. We found 9 systematic reviews of medium and high confidence that looked at the effects of mental health and psychosocial support programs in fragile contexts. And what these found is there's evidence that CBT has a positive influence on a range of outcomes, especially among populations of children affected by armed conflict. And yet it's also important to note that the effects of mental health and psychosocial support interventions vary by age. And as what's important for policymakers then is this is something to take into consideration when deciding what type of intervention to do. You have to think about what are the populations that you're trying to support and the different ways that they might react to different types of mental health support. And so this is just to show how can the EGM inform policy and practice. So one of the ways that we hope that people will use the EGM is by consulting it when they're designing new policies and programs. As I mentioned, especially for the systematic reviews, there are summaries available in the accompanying report with the evidence gap map of the key findings of each of the high and medium confidence reviews. And there are also links to each of the underlying impact evaluations within the map. Where no evidence exists, where there are the blank boxes between an intervention and an outcome, where we do think that it's possible that that intervention could plausibly have an impact on that outcome measure, we hope that people will consider incorporating impact evaluations within their new programs. Where there are existing impact evaluations and no recent or high quality systematic reviews, then we hope people will consider undertaking a systematic review. The reason that systematic reviews are important is because they allow us to avoid the dangers of single study, of relying on a single study, which might have effects that are specific to a certain context or that were unique to a given context based off of factors that might not be well understood. And so by looking at the evidence for an intervention on outcomes of interest in a variety of cases, you can have a much stronger understanding of how this intervention works, why, under what circumstances, and for whom. And the thing to note about systematic reviews, however, is that they do take quite a bit of time to develop. And so when it comes to policymaking processes, the earlier that an evidence gap map can be consulted, the more likely it is to be useful to the program policy design. Oh, sorry. Okay, and yeah, I skipped a slide, sorry. My computer skipped ahead a couple. In terms of how, oh no, that was my slide. Implications for research. So another thing that struck us when we looked at the results of the systematic reviews that were included in the map was the striking similarity across all of the different systematic reviews in lots and lots of different, very kind of different interventions, both looking at mental health, to those looking at cash transfers, to those looking in governance spheres. They had very consistent findings on research implications. I think that just goes to show that, you know, across this sector, we have a lot of work to do on improving research quality, and we hope that initiatives like this can help us move in that direction. So we have a number of implications for research from this map. And the first is that it is possible to do rigorous impact evaluation in fragile contexts. Though it's challenging, there are many, many examples at this point of rigorous research having been carried out despite the challenges. However, as we noted, the evidence base is very fragmented. And so one next step that could be really interesting to work on as a community with researchers and policymakers and implementers is to design a coordinated approach to the research program, to come together and think about what are the most important questions for which we don't have any impact evaluation evidence, and how can we make sure that we don't duplicate efforts, but that we coordinate and see to what extent we can work on building that evidence base. Similarly, at an outcome level, in order to be able to effectively synthesize findings, we need to make sure that the outcomes that they're measuring are similar enough that you can, you can say, okay, well, this happened in one place, but this happened in another. And if they've measured completely different things, it's really hard to know if the differences you're seeing are because of the way they were measured or the things they were measuring, or if there was some similarity there. So working on coming up with some core outcomes that as a field, we can say these are really important ones could be another very useful next step. And finally, there's also a large opportunity to focus on substantive evidence gaps, particularly around complex multi-component interventions. It was striking that within the included studies, we only found 2 interventions that aimed to implement strategies across all 4 of those quadrants in terms of the 4 different strategies for building sustainable peace, engaging more people, engaging key people, and targeting both individual and socio-political level changes. However, within those 2 interventions, each component was evaluated separately. And so even though we do have an impact evaluation of those 2 programs, we don't yet know what the value add is of doing that approach. And so in that sense, the theory of this reflecting on peace practice matrix that suggests that marrying individual level changes with sociopolitical changes is critical to building sustainable peace. That's a theory that we haven't yet been able to test at a rigorous level. Finally, we also found very few studies that measure cost effectiveness or that present any cost outcomes, even though that is a key area of interest for policymakers. And finally, again, there is a need to adopt equity sensitive research designs in all research as a best practice, but especially in fragile contexts. We think it's very important to make sure that your research is taking into account the potential sensitivities. So that is my talk. Thank you very much for listening. And I would like now to hand it over to Professor Brück.
So thanks, Ada. Just briefly before we hand over to Henriette, just we've got lots of great questions coming through on the chat. It will help us, and I've tried to keep a note of those, but it will help us to respond to those if you put them in you use the Q&A function instead. Yeah, so thank you. And over to you, Henriette. Thanks. See, I think you're muted, Henriette.
Right.
Yeah.
Good afternoon to everyone, and thank you very much, Ada, for your presentation. Well, I have a small presentation myself, but I'm not sure whether I actually can show it to you. Let me quickly see whether that's happening. Maybe it's not happening. Anyway, that's fine as well. Well, Henriette Sachse, it's my name, and I'm working as a senior policy advisor at the Division for Transitional Development Assistance at the BMZ, which is the Federal Ministry for Economic Cooperation and Development. And the TDA, the Transitional Development Assistance, is one of our, well, key instruments in crisis, in working in crisis countries and fragile countries. So we have an annual budget of about 850 million euros, and We work in about 30 countries currently. Of course, we have a lot of partners. On the one hand, our GIZ, the KfW, but of course, we work with more than 30 non-governmental organizations. And also we work with the UN system, and especially with UNICEF and the World Food Programme. So what we do, maybe just to give you an idea also in how we see evidence and how we also try to generate evidence ourselves, we have, on the one hand, we try to see, and that's why this evidence gap map is so important to us, we try to see what is there at the moment, what evidence do we have in different fields, but the social cohesion and peaceful societies is one of our main fields of interventions, and that's why it's so important to see what evidence do we have already. And in that sense, this evidence gap map is very, very important to us. What we, Ada mentioned already, there are a few systematic reviews on the way, and two of them, that's the one for social cohesion, and then the second one about the role of women as agents of change, we commissioned with 3IE, and we're very happy to see during this year we see a few results, and then we are also happy to share these results with our partners, and maybe have a similar webinar later in this year or maybe next year. And then that's basically seeing what evidence is there. But then also we try to generate evidence ourselves in our projects, in our programs. And we commissioned quite a few impact evaluations. One big one also in cooperation with DEval and DIME in the Sahel. And also one is commissioned in Congo. Both with, these are basically impact evaluations for joint programs by the UN system. So these, well, we'll try to contribute as well in terms of evidence and try to see what works and what doesn't really work. And we see first results of these impact evaluations probably by the end of this year as well. So maybe just a few thoughts why this evidence gap map, but also why this topic of social cohesion is so important for the BMZ, but especially for our division, for fragile countries and for building resilience. We have a new strategy coming up, and we hope to launch it very soon. And the strategy also has a very has a very strong focus on social cohesion, because we think social cohesion is one major element of our work, and we need to strengthen this. So what we are going to do with the evidence gap map, of course, but also with other products like those systematic reviews we were talking about, and also results from our impact evaluations, we're going to share these information with our partners, NGOs, GIZ, and so on, and we're going to discuss some of the findings, and we will encourage all our partners that they take these evidences in consideration when designing new programs. So this is very important. And then on the other hand, as you all know, the humanitarian development peace nexus is very important, and the TDA, the Transitional Development Assistance, is an instrument that really brings together, or is like a bridge that builds from humanitarian programs to development programs and also to the peace component. And what we see is that especially the peace component is raises a lot of questions. raises a lot of questions in regard on how to implement it, how to program it, how to design it, what works best. And also for this, for kind of to operationalize the HDP nexus, this evidence gap map we're talking about today, you know, can help us to see what we can learn from the evidence so far, and maybe also to see where we don't have evidence, but then maybe we need some more evidence, or we can at least conclude and try to put some conclusions in our design. And especially if we, I see that we're also going to discuss or share the evidence gap map with our partners from the Foreign Office, because of course in the German system they have the mandate for the humanitarian responses, and we work very closely together, especially when it comes to operationalize the humanitarian development peace nexus. So in short, I guess we have a lot of areas that we can build on. I'm very happy that we have this evidence gap map. I'd like to thank 3IE, DEval, well, BMZ, of course, as well. And well, we from the BMZ side, we want to use this evidence gap map, and also maybe even go further in designing new policies and programs. And I think that's it's also a great opportunity today to to see so many participants, and as Marion said, of course, I think the interest, especially in the field of social cohesion, is very big, and so I hope the outcomes will be very good as well. Thanks a lot.
Great, thanks, Henriette. So over to Tilman.
Yes, thank you all for the great project, for the very interesting presentations and comments. I really think this is an excellent project, and I'm glad you tackled it, and I think you tackled it really well, and I really enjoyed reading your report. I've been asked to comment for up to 10 minutes, and maybe the organizers would like me to go on for 10 minutes about how much I really enjoyed reading this. But instead, I thought it might be more interesting if I just share some reflections, things that came to my mind as I read the report, and which might help contextualize some of the things you have said just now. So I don't really want to repeat what you said, or I don't really want to go into the methodology so much. There've been excellent questions to the research team on the margin here of Zoom, and I think those are very intelligent and worthwhile questions. I'm glad that the audience is engaging so deeply with this report, but I have a couple of minutes. Let me go one point at a time, one point, 1 minute. It's perhaps a bit unfair on the research team, because each of those comments could be, there's a lot behind it, and maybe we should have spent more time on each, but maybe that's a good way of starting the discussion as well. So the first point that I'd like to address is the context versus the aims. Now, on the one hand, we are looking at, sorry, I need to click on this window here. On the one hand, we are interested in understanding development in fragile or insecure settings where there is no peace. And most of the development interventions where you probably added the budgets might fall into this ground, helping kids go to school in fragile countries, etc. But they're not as such meant to overcome fragility or insecurity. And I think that is something in the programming community we have to be very clear about. Is this an intervention that happens to be in a fragile or insecure setting? Or is this an intervention that happens to tackle fragility and insecurity? And potentially the production processes of these interventions are very different, because the drivers of development and the drivers of fragility or insecurity may be quite different. And so, that's my point here, that these are potentially fundamentally very different things. And I think what I observe is that sometimes the boundaries between the two get blurred in a way that wasn't really deliberate. Maybe there's funding for reducing fragility, and then a donor says, I have a great project for helping kids go to school. Then a fragile setting, I will just claim that this intervention reduces fragility, when in fact it's a really good program for getting kids to school in a fragile setting. Likewise in the employment sector and elsewhere. So we have to bear in mind that these are potentially fundamentally two different things, or maybe they're not. Because of course the way fragility might obtain, or a lack of peace might obtain, is through underdevelopment. So the two are of course linked. And somebody asked on the margin in the chat box, have you considered unintended consequences? And a development intervention in a fragile setting that is badly planned may indeed trigger behavior that is antisocial, or that might contribute to further instability, even though it's not trying to do that. So even if it's unintentionally, the two things could be linked. So this is a difficult area, but I think one worth reflecting on, that there is an interdependency between development and peace, which is complex and not well understood. We'll come back to that point in a moment. My second thing, again, is something that has been addressed in the chats and in the comments that were posted. I want us to be aware of the level of observation. It has kind of to do with your quadrants as well to some extent, but I'm using a different chart here from a reference which I cite later in the talk. On the one hand, we can look at conflict settings and very fragile settings where the state doesn't have a legitimate monopoly on violence. That's more on the left. Or we can look at the middle bit, negative peace, absence of fighting, absence of killing, or positive peace, where we have strong development-oriented institutions which are democratically legitimized, etc. Now, at the macro level, we're looking more at political science behavior, sort of stuff that either is of interest to peace researchers or in the Security Council in New York, for the sake of the argument. At the bottom, we look more at economic outcomes and individual behavior and individual welfare outcomes. And I think the big challenge in this field is that both the researchers are scattered across this diagram. Some study this and some study that. Some study the resumption of violence or the origins of violence. Some study the drivers of human development. They're all over the place in terms of level of observation and disciplinary boundaries. But the practitioners likewise are scattered all over this place. Yeah, I'm not sure how much a person posted to the Security Council or permanent mission in the UN in New York, would really know about economic development on the ground in a fragile country, in a rural area. Yeah. And yet in these projects, both in these research projects and in these interventions, we need to combine this expertise across different levels of observations. We need to know what level of antisocial behavior may contribute to an outbreak of conflict at the country level, but also for the study design and intervention design, we need to bridge these different boundaries of disciplinary and level of observation. So that's another challenge that we face here in this area. Then I wondered, why is there so relatively little sort of research in this field? I mean, why is this gap map, which is valuable, but why are there so many gaps, and why is there so little map, if you like? Yeah. So and I had sort of a couple of different ideas, but maybe this is the one that sort of summarizes it the best. This is a friend of mine looking for his keys, and the story, the joke. Yeah, the keys are somewhere completely different, and he knows it, but it's very dark where the keys are, and there's a lot of light over here, so it's much easier to look here, and so he spends his time looking for the keys over here. Yeah, and I'm wondering if something similar is happening here in my community, in the research community. A lot of us are looking where the light is and not where the problem is or where the keys are. Yeah. So it is feasible to do research in fragile and conflict-affected settings, but it's difficult, it's costly, there's a lot of failures, there's a lot of aborted projects, there's a lot of delays, there's very high unit cost. Yeah, it's just very expensive to drive through an insecure area. And in one of my projects, we had a whole four-wheel drive stolen. Luckily, nobody was hurt, but that's a big setback on the budget front and on the data front. Yeah, so it's a lot nicer to do research in Ghana or Uganda, and I love Ghana, I love Uganda, but even in Uganda, it's easier to be in Kampala than to be up north somewhere. Yeah? So this is something that we have to be aware of. It's for donors as well. It's costly to pouring money into this research, and it's costly pouring money into these programs, which may or may not work. And there may be also a concern over, what if they find out our project was risky, and maybe I get graded as a civil servant by spending money successfully, yeah, and spending it reliably. Yeah. So what are the incentives for doing peace building, and what are the incentives for doing peace building research? And they're probably not well aligned with what we need in order to generate lots and lots of research and not just a little bit of research. Yeah. So when we are glad about there being dots on the map, I mean, the map should have no white by now, right? I mean, we've been in this business for 10, 20, 30, 40, 50 years, generating research for evidence making. We know how to build a school in rural India, but we still don't really know how to build peace in a conflict zone. Yeah, yet that's a really big challenge. So there is a problem in a sense in the political economy of how funds and incentives are aligned. Then I sort of thought theories of change. They were mentioned, and again, there was a discussion about what they are and so on. And I think it's critical that we make explicit what our theories of change are. Unfortunately, many times they look like this. And it's really hard to know in a project, what leads to where and how are things connected. And if you're really interested in pulling out the blue thread, what is it you have to do, falling short of taking a pair of scissors and just chopping it all up, or going out to the haberdashery shop and just buying a new bundle to start from scratch, which in peace building is not always an option. So I think theories of change are incredibly valuable, understanding how things are related. Actually looking at this thing, it really reminds me of medicine. I mean, this could be like our body, like it's very complicated to know how the different parts of our body fit together. And sometimes social, rigorous researchers laugh about doctors and, they do all these observational studies and it's really hard to advance. But actually studying peace building is a bit like that as well, right? We have a lot of observational evidence. We don't have a lot of rigorous evidence. It's not always easy to do that type of research. And so while in the theories are relatively easily postulated, mapping them into the program design is tricky and faces, again, practical barriers. It requires the staff and the people who design these also to be familiar with these theories and to be able to break them down into operational bits. So it doesn't help to read some, fundamental treatise on how human nature works if you're there trying to help people in a particular country not engage in violent behavior. You need to break it down more practical. So I think on the theoretical side, research should also help to offer, easier sort of concepts to apply. So you have like building blocks. If I want to design an intervention to make people rub along better in, say a refugee camp and the host population, how can I help them rub along against each other better? It's also, we need to provide ready-made and ready-tailored theory exchange which don't look like this. Now, there is in this field a very high risk of a null finding. So we don't know how things hang together so well. That was my previous picture. So we start looking for something, and it could well be that our study finds that there isn't a link. And several of my studies in peace building have found that the intervention actually didn't work. So I put up this picture. I don't know if anybody knows which nut this is and why I put up a picture of a nut here. It's actually a macadamia nut. And I read that they are some of the hardest nuts in the world to crack. So I thought they had a lot to do with peace building. So it's rare you find these nuts in a shop unpeeled, because you would not manage to do it yourself at home. So in a sense, we are like the people who are trying to crack these nuts open, and just taking a hammer to them is also not that good, because then you might end up breaking the nut inside, which is not what we want to do. So it's difficult doing this research, and we need a culture which also maybe not rewards, but accepts that there may be a null finding, which accepts that we may find something doesn't work, or that. And that's not a failure, but that's just to say that there wasn't an impact and there wasn't an effect. And then maybe the very important question is, why wasn't there one? So it's often doesn't matter so much that we find a 17% increase in peacefulness in a society, but maybe we understand why it came about, and if it didn't come about, why it didn't come about. So I think if we focus more on the mechanisms and less on did my program work or not, I think we can make a lot more research and a lot more interesting research in the future. Now, my final point is that with the systematic reviews, I'm grateful if you have good systematic reviews, but I have reviewed a few previously where I sort of, where the conclusion basically was we checked 1,000 different studies. We found 995 of them weren't really very good enough qualitatively. We found 5 good studies. 3 of them had null findings. 1 of them said yes, and 1 of them said no. This is my systematic review. And then a lot of people ended up citing this paper because it was the first systematic review ever, but they ended up saying, as this systematic review shows, half the studies, showed yes and half the studies showed no, when in fact the evidence base is extremely small. So what I'm trying to say is we might have to increase our evidence base, the eggs, a lot more before they hatch and we can count the chicken, Sorry if that's a slightly convoluted thing, but I really like this picture, so I thought I had to share that, Copyright to IFAD. So I think it's really important that we persist in making lots and lots and lots of evidence, because this map is still far too empty. That's not the fault of the people making the map, but although there were some comments asking for clarification of what was included, what was not included. But even if we were to include more studies, still the evidence base isn't there where it needs to be. And compared to cash transfer literature, education research, health research, in the peace building field. I think we need a lot more before we can start doing, very large scale, before we can do regressions with our impact evaluation results, and do sort of meta studies. So I think I just want to say that this is a long-term process, and also if we flag individual studies, or if a donor commits to doing a single study, that's wonderful, but we need dozens, if not hundreds of studies before we start getting at stylized facts and having sort of established and a ground which, where we know how it really is across all these different contexts. I hope that it's not too negative, but one sort of suggestion for what might be a way forward is, we didn't really discuss SDG 16. Now, I have mixed views on the usefulness of SDG 16, so I don't want to overemphasize this. It's a very mixed bag, and there's lots of stuff in there which is very weird, but the one thing that I really like in there is the emphasis on institutions and inclusiveness. So not just on the absence of violence. So it's sort of a positive piece, an attempt at tracking positive peace. And there's some interesting indicators here, which I think that might be another way of moving forward. And it's complementary to what has been suggested in saying the measurement of these indicators in most countries in the world is very weak and it's not very good. But if national statistical systems strengthen the ability to track these, including through survey data, some of these are micro outcomes, that would dramatically improve our ability to do good research. So I think it's also a question of statistical capacity and placing peace and security and strong institutions which are inclusive at the heart of general data. And I love poverty data as much as I hate poverty, but data helps to overcome poverty. Let's get the peace and peace building data out there and mainstream it so that research can be done all around. And I think that might be one way to frame this this debate. Social cohesion is lovely, but it's one aspect, and here this is a accepted international norm on how to measure these things. Might not be perfect, but it's a good start. I don't know if we can share the slides afterwards, but there's some things of what I said are also reflected in my writing. And if you have any questions, please feel free to get in touch by email or Twitter. Thank you very much.
Great, thank you. Thanks so much for both Tilman and Henriette for your very useful reflections and comments. So I'm going to try and now put some of the questions. We have lots of great questions in both in the chat and the Q&A. So I'm going to try and perhaps give the opportunity to respond to some of those, and then Tilman and Henriette, if you want to comment, that's also welcome. So I think there are kind of some quite a few questions that are in terms of they are asking about the inclusion criteria. So kind of defining the types of studies that were included, including whether qualitative evidence was included. And I guess perhaps a related point is, there's a question around the ethics of doing, for example, RCTs in humanitarian contexts. And then there is also several questions about the intervention outcome framework or the typology. How was that developed? And then there was also several questions in terms of the search. So, what sources did you search, languages, etc. So I think perhaps we start with that, and there are lots more. So if you could try and be brief, that's great. Thank you.
Great. Well, thank you all so much. These are great questions. So where to start? In terms of the framework, I really should have mentioned that we worked really hard with a very wide-ranging stakeholder engagement group in Germany, and also with an online group of international experts scattered around the world in order to put together the intervention and outcome framework. So that kind of typology arose out of a full day's workshop with researchers and implementers and civil society representatives from BMZ, DEval, and GIZ, and we worked to try and see what are all of the different ways that those institutions and the people in that room were aware of people trying to build sustainable peace and the different possible interventions that may influence the context and the conditions for peace, and how best to group those. We spent a lot of time with the outcomes trying to figure out what was the best way to present the outcomes, because there are so many different ways that you could do it. You could look at the level at which the outcome is reported, whether it's an individual level outcome or a community level, etc. We ended up going with the approach that we did because it allowed us to emphasize the first few outcome groups, of governance, social cohesion and trust, and violence reduction as being sort of the core outcomes of interest for building peaceful societies. Just given, the assumption is that those are almost prerequisites for sustainable peace. And that then, however, with our approach to peace building that I discussed in terms of the big tent approach, where we expect that it's not only interventions that directly engage with the actors or parties to a conflict, but also that address the underlying drivers of stresses, that theory is based off of a human security lens, which suggests that people, in order to be fulfilled in their lives, but also in order to have kind of the absence of fragility, in order to have a peaceful, sustainable, peaceful society, you need to be able to support people's multi-dimensional human security. So their health security, educational security, livelihood security, etc. And so we try to use that human security lens to group the latter set of outcomes. In terms of the search process, I think the first thing to note is that, as much as we made all of the efforts that we could to do a systematic search and find every impact evaluation that we could, there are always going to be some that we missed. Our search terms, the words that we were searching for were in English. However, we did not exclude studies that weren't in English. So anytime we found a study that was written in a different language, we either put it through Google Translate, and if it looked possibly relevant, then we tracked down someone who spoke that language to make sure that we weren't excluding any evidence just because it wasn't in English. We searched about 4 or 5 different academic databases and over 30 different websites in the gray literature. So that was institutional websites, multilateral, bilateral agencies websites, repositories of impact evaluations and other evidence such as 3IEs and the World Bank. And then we also worked with our advisory group and with our stakeholder engagement group, who helped with putting the framework together, to ask them to send us any impact evaluations that they were aware of. So we made every effort that we could in order to be systematic and thorough in our search, but it is, especially for studies that were not in English, it is probable that that's just a limitation of the methods that we used. In terms of the inclusion criteria and what is on the map and what isn't, we did not include humanitarian response interventions. So that's worth noting, that there are interventions that are, providing emergency food or water, emergency shelter are not reflected in the map. This is because the focus was on the more longer term building sustainable peace approaches. We don't mean to say that humanitarian interventions are not very important in fragile situations. They obviously are, but the focus of this map is on interventions that are mostly focused on building longer term conditions for peace. In terms of study designs, we only ended up including in the map experimental and quasi-experimental evidence. However, our search included search terms for qualitative impact evaluations, such as realist evaluations, process tracing, contribution analysis, etc. And we reviewed all of the qualitative evaluations that we found, but we didn't actually identify any qualitative, we identified one qualitative impact evaluation that used a recognized method for assessing for trying to assess attribution or contribution of effects to an intervention in a small n, so like with a small sample size. The only one that we found that used, one of the qualitative research methods that have been designed to address this impact question was of a realist evaluation looking at the impact of a demining program on livelihoods. So even though that study is not in the review, we did look for that type of evidence, and we do mention in the report that we were only able to find the one. In terms of other study designs, we think they are extremely important as well. Impact evaluations are not the only form of evidence. They are we think they're a particularly important form of evidence. Of course, it's in our name, but it's not the only type of evidence. And evidence from process evaluations and implementation research is also extremely valuable, especially in contexts like this. And we would love it if somebody wanted to take our MAP framework and do a search for implementation evidence or for process evaluations. The idea is that we tried to build the MAP framework in such a way that it was comprehensive for the type of programming that happens and the types of outcomes that could be expected to be changed, even though we don't expect to actually find impact evaluation evidence for all of these interventions. Take the demining program, for example. You don't really need to do an expensive, rigorous, in-depth impact evaluation to know that a community that's had its mines removed is probably better off than one that has still littered with landmines. There's not every question needs to be answered with an impact evaluation. And we recognize that. And so our framework was built in order to be comprehensive in terms of the programming, in the hopes that it would also be useful for additional type of work that would map other types of evidence. In terms of the ethics of RCTs, we think this is one of the reasons why it's so important, and that we talk so much about the extent to which studies address ethics and equity in the research, because it is a major concern. When it comes to allocation to treatment, however, in most cases, programs aren't able to provide help to absolutely everyone who needs it. And so a lot of RCTs in fragile contexts will take an approach where they have a list of potential participants or potential beneficiaries who meet certain criteria for need, and they don't have the budget to give all of them the intervention all at once. And so there's a lot of phased designs where you'll say, okay, we'll start with one group and provide the intervention and use this other group as the comparison for the first round. But the expectation of everybody is that after the first group gets the intervention and after the impact evaluation evidence is collected, the second group then receives the intervention as well. And so that's one of the ways that they try to address the ethical considerations. I think those are the main points. Oh, there was one small one on missing civil society research that I noticed in the chat that I just wanted to say that was also something that we were a little bit surprised by, because I think that's such an important element of programming for building peaceful societies. Civil society has a huge role to play. I don't know why we couldn't find any impact evaluations of civil society programs, but my guess is that maybe it's because that civil society is often an added-on component of a larger intervention. So an intervention working to improve governance and accountability may include support for civil society organizations, but that's not the main focus of the intervention. And because in our map, we didn't want to overstate the evidence by listing the same study more than once. So each study that we identified was only allocated to one intervention category, and where we had groups of studies where, you know, we found lots of studies that included support for livelihoods and maybe mental health support, or livelihoods and some form of education. And so we've grouped those types of more multi-component interventions in a livelihoods plus row. If you look on the map online, you'll see that. You'll see a couple of these different plus interventions where we captured some with multi-components. So maybe there's some civil society evidence within that, and maybe there's some civil society evidence scattered within, but we weren't able to find a study that looks specifically at it. Yeah, over to the others if they have anything to add.
Tilman, Henriette, Marion, do you want to add anything?
Not from my side. I think Ada responded kind of perfectly.
One question perhaps that Tilman, you could have a go at is, so there's a question about any thoughts about why there are so many more experimental studies than quasi-experimental studies?
So I think I wasn't sure when the comment whether that referred to sort of experimental as in a lab in the field. If it means that, then that's relatively easy to set up. I mean, we can do behavioral economic analysis with lab experiments where we ask people at the computer, you know, would you share this dollar with the person at the other table, etc. You know, those are relatively easy to set up, and we can generate sort of field in the lab experimental evidence in conflict and fragile affected settings. You know, you find a big tree, you set up some computers, you invite some people, you pay them some money, you get some results, and then you say in this country people are more willing to share, or in that country they're less willing to share. Yeah, so I think it's partially, okay, it's partially a trendy topic in academia, and partially it's relatively easy to set up. I think if you're asking RCT versus quasi-experimental, then I think it's actually difficult to have, you know, good RCTs where you randomize in an ethical way. It's not impossible, and it might be perfectly legitimate. For example, if you haven't got a clue what the better way of doing it is, so especially if you randomize across different treatment arms. Yeah, so that's maybe more question for the authors of this report, but generally speaking, I think in these settings, the interesting comparisons are not, somebody gave this example, you know, demining or not, you know, that's not an interesting example for a randomized intervention. You know, you don't want to randomize some landmines are removed and some are not, and then we check whether the kids still get hurt in the areas where they have mines. You know, that's not an interesting or relevant or ethical question. Having said that, if you have a very limited budget, of course, the rollout of the demining, you could randomize that if you really wanted to understand how inhibiting the demining is. I mean, there are some people who say it's actually much cheaper to demarcate the mine areas. You know, demining is extremely costly, and so, you know, when budgets are really tight, maybe you should, I mean, I'm just giving this as an example. I don't really discuss demining with everybody, but, you know, so we could roll it out, and if we wanted to know the economic legacy of living in a mined area, you know, the randomized rollout of a demining program might actually be legitimate and ethical. But often it's the different treatment arms we're interested in. How do you do something? Not if you should do it. Yeah, I think you should do peace building in most cases, but, you know, how should you do it? And is it better to bring people together through, you know, applying contact hypothesis so that they know each other, and then they get to know each other, and they know that, you know, put a face to the other ethnicity who they weren't very familiar with, and then they're not so much against these other people, whether they're refugees or ethnic minorities or whatever? Or is that not a good way? And if you bring them together, how do you bring them together? Yeah. So I remember one very striking field interview with a woman who said, you know, I work every day together. It was in Lebanon, a Lebanese woman. I work every day together with the woman from Syria now, and, you know, we're best friends, but I really wish the Syrians would leave this country because my husband got unemployed because of them. Yeah. It's awful that they're still here. Yeah. So clearly there was sort of, she had gone half the way, but not all the way. Yes. She still resented the Syrians, but at least, you know, she started seeing some individual Syrians and didn't mind them individually, even though collectively she still resented them. So how would you get people to be more peaceful and accepting and tolerant? That's a very difficult question. And so treatment arms, testing different treatment arms and trying that out. I think it's sorry for the comparison, but it's a bit like how to treat COVID-19. We don't know, and so they try all the different medicines, and they don't know what's the better one. So randomized treatments of medicines in Corona times is completely legitimate if you haven't got a clue what will work and what will not work. And sometimes in peace building, we're in a similar situation. Over.
Great, thank you. So there was another question here that's sort of along slightly different lines, but I wonder whether particularly Henriette might have something to say on this. So it's a question about whether one could apply the evidence gap map to assess the gaps in evidence and knowledge of an organization to inform future programming. So this is sort of a type of use that we have seen some interest of organizations to actually use an evidence gap map as a kind of internal knowledge management planning tool. So I wonder if Henriette, if you have any reflections perhaps on how you might want to use it, and if this is one of the ways.
Well, actually, well, I'm not sure. I mean, I mean, everyone, and also we as a BMZ, and also as the division TDA, Transitional Development Assistance. I mean, we try to have a management or like a knowledge management system, and we try to, figure out what results, what studies, what can we use to make our programming better, and discuss this with our partners, as I said. But maybe let me just go to two more questions. There was one about NGOs and the role of NGOs in terms of impact evaluations, and whether these have been also put in the evidence gap map. Well, other answered already, but I just would like to underline that, I mean, we try to talk and have a dialogue with all our partners in terms of strengthening evaluation, strengthening monitoring systems, and also providing budget for rigorous evaluations. So in that way, it's also our NGO partners that could go on and and try to establish more impact evaluations, for example. So and I think the BMZ in general is trying to encourage the partners to try different ways of also generating evidence. I mean, there was one question in a chat about tacit evidence and what people know who are working in the field. And of course, there's a lot of knowledge, practical knowledge in the field, but that's very hard to tackle and very hard to use. I mean, for everyone. So in that way, of course, it's always very important to have good monitoring systems in place, to have good evaluation systems in place, and even to go further and maybe strengthen also impact evaluations. I think not everyone is so familiar with them already, especially in fragile countries and fragile contexts. Yeah, maybe as a comment.
So maybe I can give a response to the question that you just asked, Henriette. So I know from some German organizations, I think it's Miseria and Brot für die Welt. So they are basically church organizations, and they have used the framework of the evidence gap map to map their own evaluations. So I think that's what Ada said before. So just arriving at the framework, it was such a huge effort already. And I think it's such a value to have now this framework, kind of the metrics, and to see what kind of interventions are there in the first place that could help to build peaceful societies. And this can, of course, be used from any organization to see which evaluations within this organization have already been done and where are the gaps. So I see a large value in this, and I think Miserio and Brot für die Welt are very happy to share their experiences in using the framework. So if anybody interested in this, just let me know and I can put you in contact.
Great, thanks, Marion. I think we can, yeah.
Could I just, there was one point that I've meant to raise and forgotten. It's come up in another couple questions, so I want to just highlight it quickly. And that's also around the question of what's in the EGM and what isn't, regarding how we defined fragility. And I think that's important to note because we make in the map that you saw, that was based off of a state level analysis of country fragility scores. However, we wanted to make sure that in the EGM, we did not only consider contexts where there was already violence or where there was already high level, something that was a really fragile situation, but we also wanted to capture those situations that might become violent. And so try and also capture work that was happening in places that might be quote unquote pre-conflict or at risk of deteriorating into conflict. And so the way we tried to do that was through a nuanced definition of fragility, where we looked at a few different criteria. And the first was whether or not a country showed up on the Fragile States Index with a score of 90 or above. But then if not, we looked to see what the reasoning was for why they were doing the intervention. And so if in the study, they specifically said, we're implementing this intervention because there were these tensions and we are trying to address those, then that we considered fragile. And that was a way for us to try and incorporate a broader range of contexts. So we wanted to also include, for example, places racked by gang violence, where maybe the state itself is entrenched, but there's high levels of violence in certain communities. So we wanted to make sure that we weren't only using a state level definition of fragility, because we recognize that levels of fragility vary widely within states and within communities. And so we were trying to be more nuanced about that. So I hope that answers some of the questions on, those types of things. Thanks.
Great, thanks, Ada. So I think we don't really have time to address many more questions. So but perhaps one is the issue of children in conflict. The extent to which there was reference to that at all. So I wonder if Ada, if you can comment on that, and then I suggest if you or any of the other panelists have any final remarks, this is your chance to make them before we wrap up. Thank you.
On the question of children, as I mentioned when talking about the findings from the mental health and psychosocial support systematic reviews that we extracted, there were findings that suggested that different types of mental health support affected different age groups in different ways, and that some might be particularly effective for children exposed to violence. Beyond that, because I don't have a lot of, I'm not able to tell you in what way the studies engaged with children. However, on the map, if you filter it under population, you can pick adolescents and see quite a bit of evidence for adolescents. You can also look for evidence for children under 12. And again, there's evidence for peace education, for social inclusion and reintegration interventions, for mental health, for social funds. And so there's a couple, and you can scroll down and see where the evidence is. And so I would encourage you to look, to play around with the map and find it there. Thanks.
Maybe briefly on the issue of children, but also connecting to the points about fragility made earlier, maybe children as a particularly vulnerable group indicate very well or reveal very well how conflict, fragility, weak human development all interact very well. So in fragile settings, the state is not very effective or present or capable of doing what it's normally supposed to do, which ranges from suppressing other actors being violent to delivering strong social services. And so you get any situations from, you know, children being recruited as soldiers, suffering lots of domestic violence, sexual violence, from working, from, you know, because rules and regulations and norms are not being upheld. And so it becomes easier to manipulate children. It makes it easier to make them into actors of violence. It facilitates the outbreak of violence in some situations. And so you sort of see how this whole weak development, fragility, conflict trap can emerge. And I think that crystallizes it very well. Having said that, my impression in general is that there is a particular gap in looking at how both fragility and conflict impact on children and how interventions can help them. So there is a bit of an action bias by some intervention agencies saying we have to help, we don't have time for research. It's a bit like in the humanitarian community, you know, like, and so that's, I think, one challenge to overcome. There is a bit of an ideological barrier maybe towards these sort of rigorous studies saying, oh, but you know, wouldn't be ethical to do such research on children, which I think is probably more based on a misunderstanding of what this research is about and how it works. And I think the worst thing for children actually is if we don't understand what keeps them in poverty and dependency and violence. Yeah, so I think absence of evidence is one of the biggest facilitators of development and peace building. So I think that's maybe shows how much evidence is missing, the fact that we don't really understand how children are affected and how we can help them. Thank you.
Well, maybe one last comment from my side. I mean, with the TDA, the Transitional Development Assistance, we work very closely with vulnerable groups on a direct level and also with communities. So we're not working so much on a state level, maybe on a regional, but not really state level. And what we see there often, or what we try to do and what we try to focus on is, I mean, it sounds easy, but it's often quite difficult to do no harm, of course, but also to do some good. It's nothing new, but especially regarding social cohesion, it's what we see is that it's very difficult and you need to contextualize your programs. You need to contextualize really your interventions so that in order not to foster underlying social conflicts. So, by saying that, I mean, I see, and I hope that the evidence gap map and also other studies and other, can help us also to pin down what could work, and then by contextualizing, adapt it to the fragile, to the specific context. Well, thanks again.
Great. Thank you. Marion, do you want to say anything? No?
No, thank you.
Great. Well, thank you so much to Ada and to the panel and to all of our attendees. It's been great to see such interest and we've been quite busy on both with the chat and the Q&A, and we've tried to address as many questions as we can. I'm sure that Ada will be happy to respond to any follow-ups that you have. Just to say that the report is available from our website, and so is the evidence gap map itself. We're working on a policy brief, which should come out over the next couple of weeks. Finally, a plug for our other virtual events. So we will have, throughout May, we are running virtual evidence weeks where we have at least one event a week addressing different relating to evidence and with a particular focus on cost effectiveness. So I really hope that you will join us for that. So thanks everyone, and have a great rest of your day. Take care.